Hi, this is Matthew Taylor. I'm going to do my speech on vaccine hesitancy and the importance of facts, trust, and compassion. My audience is my brother, if you want to show them, Blake, and my mom. We're all a little sick right now, so we're trying to be careful with the amount of people we have, but I'll get started. So the past 2 years have brought forward issues none of us could have anticipated, one of them being vaccine hesitancy. Vaccine hesitancy is a reluctancy to getting the vaccine, and in a health crisis, this resistance must be addressed, and the best way I believe as individuals we can start is by better understanding the reasons for this hesitancy. My oldest sister went months without getting vaccinated, not trusting the science and concerned by what she has seen online or heard from others. In fact, the Center for Disease Control compiled a study on this very issue, showing that 10.73% of people in Saratoga County, where I live, are hesitant to get the vaccine, with that number sitting at 14.6% nationwide. So 14.6% of people in the United States are hesitant to get a COVID-19 vaccination. But why? Instead of making a predetermined opinion on why someone might be hesitant, let's look at the data. Per the CDC, 59.5% of the 14.6% are concerned about side effects. 35.1% simply believe they don't need the vaccine. And 45% of the overall group does not fully trust the government. These facts are important for one's better understanding of why, but also these facts contain the answers to overcoming hesitancy. Let's take the vast majority of those who are concerned or hesitant, the 59.5% of those people who are concerned about side effects. It is most likely an effect of rampant misinformation. Doctors from Johns Hopkins Hospital compiled a report on this misinformation. One example being a false report that surfaced on social media. The false report said that getting the COVID-19 vaccine would cause a woman's body to fight this different spike protein and affect her fertility. This, of course, is not true whatsoever, but I could understand reading that as a woman and not wanting to get vaccinated. Dr. Bailey, in an American Medical Association panel discussion, discussed the emergency use authorization and encouraged fellow physicians to remind people of the vaccine's safety and effectiveness, with Dr. Srinivas adding that the development process for the vaccine has been under development for decades, meaning that this vaccine is safe, tested, effective, and misinformation around side effects are unfounded and untrue. Now that we have discussed and provided factual information to clarify key points of hesitancy, I would like to expand on the ways we can assist individuals in overcoming their hesitancy. Further stated in the American Medical Association panel, what people want are facts, and they want facts from apolitical sources and people they trust most. It's physicians, pharmacists, and other healthcare workers. It's pastors and other faith leaders. It's parents and peers. I work at a pharmacy and see it with customers every day. When they have a concern and they get to discuss it with the pharmacist they've seen for over 20 years, they know that they are getting unbiased information, and then they can decide to get the shot, and most often they do. I know from having conversations in calm, informational way is the best way to allow someone to overcome their concerns. Having the information and background on vaccine hesitancy can help better prepare people for conversations with those who may be hesitant, and may allow those conversations to be more productive. Providing factual information and understanding the reasons behind hesitancy can open channels of communication, decrease judgment, and convince individuals to get vaccinated. The negatives of misinformation and the importance of real information has greatly impacted viewpoints on vaccination. Through information and trust, we can encourage people to get the shot and end this pandemic. Thank you.